If stretching hasn't fixed your lower back pain, there's a reason for that, and it's not because you're not stretching enough. The most common form of back pain is right about here, and that is what we're talking about today. After you learn why the QL kicks in and compensates, I'm going to show you 3 main reasons along with 3 exercises that will help strengthen the areas that need to be stabilizing in the first place. And this way, you can finally start getting some lower back relief. The quadratus lumborum is a deep muscle located on the side of your spine. And its primary job is to control side-to-side forces between the pelvis and the spine. It becomes especially active when you're doing asymmetrical tasks. That could be standing on one leg, it could be like shifting side to side, and the most common form, which a lot of people don't even think about, would be just simple walking. So when pain shows up here, it is never random. It's usually a sign that the muscle is being recruited repeatedly to combat instability somewhere else. So the issue is rarely weakness, it's actually workload. It's important to know where the QL is because it is a very specific pain. And once you know exactly where the QL sits, it is very easy to determine if it's QL pain or if it's something else. So it runs from the top of the pelvis to the bottom of the rib cage, and it actually runs right along the spine on each side. So it doesn't sit on top. It's like this deep muscle right in here. So that means that it physically links the pelvis and the rib cage. And this is why in a lot of my videos, I emphasize making sure that your ribs are stacked over your pelvis when doing certain exercises. So that means that if there's any disconnect on this region right here, it automatically puts the demand onto this muscle. So that means that when pelvic motion isn't controlled or when rib position isn't coordinated with the pelvis, this is why people feel symptoms during movement and not at rest. Now I'm gonna talk about what's supposed to handle stability. Pelvis is controlled by the hips. The trunk manages force through coordinated rib and abdominal control. And this all helps the spine stay supported without constant muscular gripping. Now I talk a lot about single leg positions, but I think what people don't even think about is that the most common single leg position is considered walking. Walking is essentially a single leg movement. Without even thinking about it, you're temporarily on one leg and then you're shifting onto the next. So when the control is present, the load is shared evenly. When control is missing through the hips and the trunk, the nervous system actually looks for the fastest way to create stability. And the QL is very effective at generating side bending force. So it basically becomes a backup system. But over time, relying on a backup system for a primary stabilizer causes irritation. And this isn't dysfunction, it's a compensation pattern. And that's why you'll have a lot of people do things like trying to stretch the area. It's kind of like an automatic response that stretching is going to fix it. But the problem is that if you have a muscle that's really doing a lot of work, you're temporarily relieving that, but the pain keeps coming back because that muscle still needs to stabilize and you're not addressing the root cause. Stretching can relieve temporarily, but it doesn't change how the force is managed when you stand up and you start moving again. The body still has to stabilize and do the same thing all over again. So what happens is this muscle steps in, still has to stabilize, and it just tightens up and gets overused all over again. The muscle tightens again because the demand hasn't changed. This is probably why you've been stretching for years and still have the same exact problem. Before adding load or strength, the system needs to regain awareness. When a muscle has been over-recruited, it's often in a very guarded state. A reset isn't fixing the problem. It's about reducing background tension so this way new movement patterns can actually be learned. One of the most common reasons for side lower back pain is lack of that pelvic control. A lot of people do not know how to properly control the pelvis and often do movements with the whole entire back involved. When the pelvis can only move as like a rigid block, then the spine has to stiffen up and compensate. And this increases reliance of the QL for stabilization. You guys are in for a treat because you're about to learn how to control your pelvis in a safe position. These are called pelvic clocks, and they're one of the most efficient ways to learn how to control the pelvis. Your feet are gonna be roughly hip-width apart. From the start of this position, you're going to allow a natural arch in your back, so there should be a slight space here. This mat is going to be feedback for your lower back. I want you to picture a clock. Place your hands on your pelvic area. Pay attention because these are going to be very small and subtle movements. Without moving anything else, you're going to focus on solely moving the pelvis. I want you to rotate your pelvis down at 6 o'clock. So you should have an arch in your back at this point. Now I want you to rotate up at 12 o'clock. And then from this position, you should feel that your lower back flattened to the floor. Now you're going to rotate to 3 o'clock. And from here, you're going to rotate to 9 o'clock. And then you're going to rotate into the center again. Now you're going to rotate again, going down at 6 o'clock, again, creating that arch in your back, rotating back up to 12, back at 3, and then back at 9. You're going to do this continuous round of movement for 30 seconds. And you're going to repeat this for one more round. It's important when you're doing this, you're not forcing the movement and you're not moving excessively. These are very small shifts. You shouldn't feel this at all in your lower back. And when the pelvis can adjust position without spinal involvement, stabilizing demand decreases. This reduces the need for constant QL activation. The next most common problem is how the body handles load in single leg positions. If the gluteus medius can't control pelvic descent, then the trunk has to compensate. So for that, you want to work on strengthening the glute medius. For this, you do not need to be elevated high, something as high as a curb or even a small step. Place one foot on a low step, a box, or something that you can keep your foot stable. You also want to make sure that your hip is not dropping, everything is level. This is going to be the working leg, this is going to be the glute you're squeezing. Now you want to make sure that your back is straight, your shoulders are back and down, and you're going to hip hinge slightly. Keep a slight bend in the knee the entire time. Now you're going to slowly lower the foot until it lightly touches the floor. You're not going to put full pressure on it the entire time. Do 2 sets of 6 to 8 controlled reps per side. This trains the hips and also the glutes to absorb side-to-side forces. And when this area manages those forces, it takes the pressure off of the QL from having to step in as a stabilizer. The last most common reason I'm going to talk about today is trunk load sharing and also rib to pelvis coordination. Even with good hip control, poor rib to pelvis coordination can still overload the lower back. When the ribs and pelvis can't stay stacked and move together, force can't transfer evenly between the upper body and lower body. The nervous system then looks for support and stability somewhere else. That's often the lumbar spine and also the quadratus lumborum or QL that have to step in and compensate. They take on more work than they can handle, they get overused, they get painful, and then they also get tight. Anchor a band high and at a diagonal. Lie on your back and bring your legs up tabletop. Also, you want to make sure that your back is not arched. We're teaching your ribs and your pelvis to stay stacked. So for that, you're going to press down and slightly tuck the pelvis. It's only just to make sure that those ribs are in pelvis are in a line and you're not like this. So keeping this position, you're going to engage your core by squeezing your abs. Then you're going to bring the bands down, keeping that position, holding down at the thighs for a couple seconds, and then slowly coming back up. You're going to do 2 sets of 6 to 8 controlled reps of these. This teaches the trunk to manage load symmetrically. The spine doesn't need to do all the bracing, and this reduces reliance on the QL as a stabilizer. So remember, stretching does not relieve a workload problem, but changing how the body manages force does. When stability is distributed properly, the problem usually resolves on its own. And an extra tip, pay attention to your daily movements. When you reach to pick something up from the floor, when you bend to close your dishwasher, pull something out of a dryer, even how you shave in the shower when you're lifting a leg or tilting the pelvis. These are all things that we don't really even think about that need stability. And as always, if this video made you move better and feel better, please don't forget to share, like, subscribe, and also comment below.